Neurological disorders in pregnancy. Epilepsy. Epilepsy is the most common neurological problem in pregnancy. It can lead to subfertility due to multifactorial effects. Um, Effect of pregnancy on epilepsy: 30% of cases will increase, 10% decrease, and 60% has no change. Risk of seizures is highest in the peripartum period. Effects of epilepsy on pregnancy: fetal loss, increased risk of miscarriage, increased risk of fetal growth restriction, and fetal malformations. It increases up to 10% in some cases, while the general population it is 2 to 3%. Um, this risk is different according to the anti-epileptic medication that we use. In the preconception period, we should um, um, convert non-teratogenic or convert teratogenic medications to non-teratogenic medication, preferably to be monotherapy. We should give preconception folic acid high dose, 5 milligram daily. We should counsel the patient about the potential maternal and perinatal risks and advise about the most appropriate method of contraception. During pregnancy, we should do the first trimester scan to detect some abnormalities like anencephaly, which is incompatible with life. We should review the frequency of seizures, if any happened in the first trimester. We should do the detailed anomaly scan, fetal cardiac ultrasound scans, to because the most common congenital anomaly in epilepsy is cardiac anomalies. Regular clinical assessment of fetal growth and well-being, because the baby is at risk of growth restriction. Vitamin K in the last 4 weeks of pregnancy, and the baby should receive vitamin K immediately after birth. Postpartum, we should encourage breastfeeding, review the therapy again, and we should advise the woman on some strategies to minimize harm to her and her baby. Multiple sclerosis is a relapsing and remitting disease. Pregnancy may have protective effect with peripheral flare. Immunomodulator like beta interferon can be used safely in pregnancy. Induction of labor and CS is limited for obstetric indications only, and epidural can be safely used. We don't need to know a lot of details about these diseases. What is written here is enough. Migraine: throbbing unilateral headache with nausea and vomiting and photophobia. 60 to 70% will be improved or symptom free. No more than 10% deteriorate. Analgesia can be used, even NSAIDs can occasionally be used but should be stopped after 32 weeks. Low dose aspirin and amitriptyline gives a good prophylaxis during pregnancy.